Morning to all. I'm Dr. Asha Mahilmaran, Senior Interventional Consultant Cardiologist from Apollo Hospitals, Chennai. And I'm here to share some perspectives on the newer molecule, inclisiran, and its role in ASCVD in Indians. So Indians have a higher CV risk and experience earlier cardiovascular events. And elevated LDL cholesterol levels are crucial due to their strong and linear relationship with ASCVD risk. And for every 1 millimole per liter, 39 milligrams per DL decrease in LDL, it is associated with 21% reduction in MACE events. And this is based on both the secondary and primary prevention trials, and which have clearly shown the approach that lower is better. So the latest guidelines recommend to strike early and strike strong for intensive LDL cholesterol lowering to achieve targets in high-risk patients. Lower is better. According to the 2023 ASC guidelines, LDL reduction less than 55 is recommended in high-risk patients. In patients with a second CV event within 2 years, an LDL cholesterol level less than 40 milligrams per DL is recommended. And 2022 ACC expert consensus decision pathway also says clinical ASCVD LDL reduction to less than 55 or to 50 greater than 50% from the original levels at presentation. And 2023 LAI guidelines, the Lipid Association of India, classifies patients at very high risk to LDL cholesterol less than 50, extreme CV risk to LDL cholesterol less than 50, and if possible to less than 30, an extreme high CV risk category B LDL cholesterol less than 30, an extreme CV risk category C LDL cholesterol to less than 10 to 15 milligrams per DL. And there has been no significant reason for concern between very low levels of LDL cholesterol and safety outcomes. And this has been shown from the Fourier trial in more than 25,000 patients, showing cardiovascular benefit with further lowering of LDL cholesterol levels and with no safety concerns even with LDL cholesterol less than 10 milligrams per DL. So inclisiran is basically a messenger RNA therapy to lower LDL cholesterol. It specifically works in the liver. It mimics the body's process of RNA interference, which is restricted to cytoplasm, and conjugated with GalNAc for specific uptake by hepatocytes. And inclisiran plasma levels decline within 24 hours and are undetectable within 48 hours. So their mechanism of action is prevents production of target protein, which is LDL cholesterol, and greater hepatic uptake of circulating LDL and reduction of LDL cholesterols in the bloodstream. So there is Indian approval, CDSCO approved indication is in patients with primary hypercholesterolemia, either heterozygous familial or non-familial hypercholesterolemia or mixed dyslipidemia as an adjunct to diet, and in combination with statin or statin with other lowering therapies in patients who are unable to reach LDL cholesterol goal levels despite maximum tolerated dose of statin and adjuvant therapies like estimab and bempedoic acid. Or it can be used alone or in combination with estimab or bempedoic acid in patients who are statin intolerant. So inclisiran suitable patient profile is useful in high CV risk individuals whose high LDL cholesterol remains inadequately controlled with standard lipid lowering therapies such as high intensity statins, estimab, and bempedoic acid. It's also useful in the treatment of heterozygous familial hypercholesterolemia, where levels cannot be lowered only with statins and estimab and bempedoic acid. Inclisiran dosage is recommended at 284 milligram It is given as a single subcutaneous injection. The protocol is initial dose at day 0. The second dose is given after 3 months, and subsequent doses are given every 6 months to be continued on a long-term lifetime basis. Next. And subcutaneous injection should be given in the abdomen by any healthcare professional. If a planned dose is missed by less than 3 months, it should be administered according to the dosing schedule. But if it is more than 3 months, it should be started again with the same protocol like 0, 3 and subsequently every 6 months. And after PCSK9, you can immediately give inclisiran. There is no need to wait after the last dose of a monoclonal antibody PCSK9 inhibitor. This is CSI Guidelines 2023. So based on management of dyslipidemia and ACS, if patients have very high levels of LDL or at very high risk, other than elderly CKD patients, they should be given high intensity statin along with estimine. And if LDL is less than 55, continue the same. If LDL is more than 55, add bempedoic acid. And after 8 weeks, recheck LDL. And if it continues to be more than 55, it is recommended to add PCSK9 or inclisiran. And to maintain it to a level LDL cholesterol less than 55. This is the NICE guidelines recommended inclisiran for ASCVD and heterozygous familial hypercholesterolemia. So it is primary heterozygous familial hypercholesterolemia. Without CVD, LDL levels target is more than 5. And with CVD, if LDL cholesterol target is more than 3.5, it is recommended to combine with inclisiran. And this is the ACC consensus pathway for ASCVD and heterozygous familial hypercholesterolemia. Here also there is a recommendation for inclisiran in ASCVD and heterozygous familial hypercholesterolemia. Phase 3 trials include Orion 9, 10 and 11. And here patients were either with heterozygous ASCVD or ASCVD risk equivalent. And it was followed up for 18 months, and the trials have been concluded. Inclisiran demonstrates an effective and sustained LDL reduction with low inter-individual, nearly 50.5% of sustained LDL cholesterol reduction and 50.7% effective LDL cholesterol reduction. Inclisiran in Asian patients, Orion 18, patients with ASCVD or high risk of ASCVD. Placebo-adjusted mean percentage reduction in LDL cholesterol from baseline was 57.2%, and ratio of LPA to baseline levels was also approximately 41% lower. Inclisiran was generally well tolerated with a safety profile similar to placebo apart from injection site reactions. Well tolerated up to 6.8 years of exposure. The data has been available. And Orion 8, which is an open label extension trial, will assess long-term efficacy and safety of twice yearly inclisiran in patients with high CV risk and elevated LDL, showed inclisiran could reduce LDL levels in the long term while being well tolerated. It acts in the cytoplasm of hepatocytes and not a nucleus, so there is no risk of carcinogenicity and immunogenicity. The Orion 4 and Pictorian 2P are ongoing CVOT trials which are expected to be completed by 2027. While the results of CVOT are ongoing, recently published pooled patient-level analysis of Orion 9, 10 and 11 showed there was a significant 26% reduction in MACE over 18 months and fewer MACE compared with placebo.